Good morning, everybody. From now on the daily tile that comes out from Health at 11 a.m, we'll make sure we have a running tally of the percentage of first and second doses, so everybody can keep a tally of where New South Wales is exactly up to. So today we have 76.4% of our adult population who've had a first dose and 43.6% who are fully vaccinated. Now, it's when that number hits 70% double dose that we know the Monday after that we'll be able to have those freedoms that we outlined in the roadmap yesterday. So if anyone is interested in following the daily tally, that's now publicly available. So it'll have the number of jabs, but also the percentage as we inch closer to that 70% double dose vaccination. But as the health experts, Dr. Chan and the government has been saying, we're really keen to see that first dose rate hit 80 and above and get as close to 90 as possible, so that when we open up at 70%, we have a large proportion of the adult population who are at least one dose vaxxed, and obviously we know we'll get closer to that 80% sooner as well. To 8 p.m. last night, we had 1,542 cases of community transmission, and as the modelling we released indicated, we are expecting the peak number of cases to happen in the next week or so, and so far this trajectory is what has been predicted. And regrettably, we did have 9 deaths to 8 p.m. yesterday, and we extend our deepest condolences to the loved ones of those families, and Dr. Gale will go through the details. In addition, as you know, from Monday, because we got to that 6 million jabs by the end of August, we promised there'd be additional freedoms. Just a reminder that they kick in on Monday, and there's a couple of extra tweaks we've made to make it a bit easier for people. So if you live within an LGA of concern, obviously you can exercise unlimited. However, if you're vaccinated, your household can go out for a picnic or recreation for 2 hours every day, in addition to the exercise. So you can obviously exercise, but if you just want to sit down and have a picnic with your household, so long as the adults in that household are vaccinated, you're able to do so for a couple of hours every day as well. But of course, that has to be within the 5 kilometre radius requirement. So everything else stays the same, curfew in the 5 kilometre radius, but if your household has vaccinated adults, you're able to, and for this definition we're just saying over 18, because not everybody over 16 has been offered the vax, but if your household that lives together every day and functions together every day, you're able to enjoy some recreation in addition to the exercise provision. And for those areas outside those local government areas of concern, as you know, from Monday you'll be able to have 5 vaccinated adults who live within the LGA or within 5 kilometres of their home come together, so long as all the adults are vaccinated. We're not including 12-year-olds in that definition, so a 12-year-old or under in that definition. That means you can have 5 adults, which was the previous rule, but now you can have kids under 12 as well. You might have 2 kids each for each adult, for example, so long as you stick to the rules otherwise. Within the LGA and within 5 kilometres, you're able to have children under 12 not included in that 5 number. So today also we're very pleased to have Commissioner Dominic Morgan here, who heads the New South Wales Ambulance Service. As you know from the advice and the modelling we provided publicly, we're expecting peak hospitalisation and intensive care needs to peak in October. And Commissioner Morgan today will outline how integrated our ambulance men and women are in that program. It's really important for us to have all of our primary carers, all of our health staff who are involved in providing that critical care, whether it's at the emergency level at ambulance or in our hospital system, working together as one team. And Commissioner Morgan will outline some of the things that the ambulance service has undertaken in preparation for that surge. Also, from next week, I don't know how this will be received, but the 11 a.m. information will be done by health staff through video link, as occurred before, and Minister Hazzard or I will intermittently hold press conferences as required. So the weekend, Sunday will be the last day we officially do the press conferences in this way, but from Monday at 11 a.m, Health will provide their daily updates with all the figures, and myself or Minister Hazzard or any other relevant minister will present to the community on a needs basis. But I just want to give this strongest message, if I can, and that is we can't afford to have people let down their guard. All the work we've done in planning, all the work we've done as to what we'll be able to do at 70%, and then obviously once we present the 80% double dose, is based on the fact that these restrictions remain in place until otherwise advised. because if anything happens contrary to the modelling or what we expect, we don't want to have to revisit anything. We want to make sure that all of us enjoy those great things that we're looking forward to when we hit 70% double dose vaccination. And we are, as the model predicted, at a critical stage, because we envisage that once we get through the middle of September, all those people that have been vaccinated are going to kick in the numbers and show that the spread's reducing. One local government area which unfortunately has seen a spike in the last few days is Canterbury Bankstown, and we just want everybody in that area to be extra cautious. There was some stabilisation there, but the cases have gone up a bit. And Dr. Gale wanted us to also call out parts of the inner city. Redfern and Glebe and the like are showing some indications of increasing cases. So please be on alert. Do not let down your guard. We are doing incredibly well as far as vaccinations are concerned, but please follow the health orders. And if you're home and are breathless, you should be ringing one of Commissioner Morgan's people at the New South Wales Ambulance, 000, to make sure you get to hospital, because deterioration can occur very quickly. And make sure that if you experience breathlessness as part of your symptoms of COVID, that you contact emergency services. So I'll allow Dr. Gale to give the health update. The Deputy Premier will then talk about the regions and, of course, confirm arrangements regarding those parts of New South Wales that are coming out of lockdown. And then Commissioner Morgan will talk about the ambulance service and the response. Thank you.
Thank you very much, Premier, and good morning, everybody. Till 8 p.m. last night, there were 1,542 locally acquired cases of COVID-19 in New South Wales, and there were no overseas acquired cases. We still continue to see great testing numbers with 133,226 tests reported till 8 p.m. last night. Currently, there are 1,156 people with COVID-19 admitted to hospital in New South Wales. 207 people are in intensive care, and 89 of those are requiring ventilation. Of the 207 in ICU, we continue to see the majority of people who are not vaccinated. Sadly, we report today the deaths of 9 people who had COVID-19. They are a man in his 60s from Western Sydney, a man in his 70s from southeastern Sydney, a woman in her 40s from southwestern Sydney, a man in his 70s from Sydney's southern suburbs, a woman in her 50s from Central Coast, a man in his 60s from Western Sydney, a woman in her 80s, also from Western Sydney, a man in his 30s from Nepean, Blue Mountains, and a man in his 50s from southwestern Sydney. All of these individuals had underlying health conditions. 3 were fully vaccinated, 3 had had 1 dose of a COVID vaccine, and 3 were unvaccinated. As we've seen today as well, a number of those 9 individuals were younger people, and it's an important reminder for everybody in the community of the need to get vaccinated, to be aware that COVID-19 causes serious illness, hospitalisations, ICU admissions, deaths. So please do come forward to get vaccinated. To the families of those 9 individuals who passed away, I'd like to offer my sincere condolences for your loss on behalf of New South Wales Health. Today, we continue to ask our communities in areas where we've had sewage detections and no known cases to please be vigilant for symptoms and come forward for testing. And they are people who live in Tamworth, in Lightning Ridge, Glen Innes, Culburra Beach and Moruya areas. As we've announced previously, we continue to see high case numbers in suburbs of southwestern Sydney and western Sydney, particularly Bankstown, Fairfield, Greenacre, Liverpool, Punchbowl, Auburn, Guildford and Marylands. So for residents of those areas, if you haven't already booked in for your vaccination or had a dose yet, please do so as soon as you can. And as the Premier mentioned, we remain concerned about some emerging suburbs in the City of Sydney and inner west areas. So if you live in those areas, similarly, please book in for your vaccination. Please be vigilant for symptoms. Please come forward for testing. Thank you.
Good morning. Can I start by offering my condolences to those families who lost loved ones, and you remain in our thoughts and prayers. Well, firstly, some good news this morning with the restrictions on parts of regional rural New South Wales being announced to be lifted as of tomorrow. Yesterday, the Deputy Premier of Queensland, Steve Miles, reached out to me where we were able to task our commissioners, our cross-border commissioners, to work through the issue on the Queensland and New South Wales border. This morning, again, a conversation with the Deputy Premier, and since an announcement by the Queensland Government that we are reverting back to the previous arrangements for those communities north of this state and south of Queensland. Can I say thank you to the Deputy Premier of Queensland and to his team, to his department and to the health officials, as well as to my team here with the Cross-Border Commissioner and our officials to achieve this. This really will make a difference for those communities that have done it hard. For those that live in border communities, we know how seamless and invisible that border is, but unfortunately our communities do get impacted at times when borders are closed. So today, good news for the people of north of this state, especially for New South Wales, for the Tweed community, the Northern Rivers community, and fingers crossed we can keep the new arrangements in place to support those communities. Also, I just want to call out again, vaccination rates right across the state continue to increase. Areas like the Bega Valley, where we've really seeing significant numbers in vaccination. That's again good news, and those communities that are coming out of restriction as of yesterday that were announced, it's good news, but again my message to those communities is we still have to remain vigilant. We need to get vaccination rates up. We still need to work and be vigilant and minimise travel and mobility if we are going to continue to stay out of lockdown. We're in a really good place to have the ability to have a level of freedom in the regions. And I want to make sure that I don't have to come to a press conference to say, unfortunately, we are closing parts down. So again, to the communities to be vigilant. Part of the news overnight, again, we're stable in regional and rural New South Wales. Western New South Wales, case numbers were 28. Dubbo had 18 cases. Mid-Western, 6 cases. Burke, 3. And Blaney, 1. In the far west, there were 5 cases, 2 in Broken Hill and 3 in Wilcannia. In the Illawarra Shoalhaven region, we continue to have its stable numbers, but they aren't high numbers. 38 cases all up. 28 cases were in the Wollongong local government area, 8 in Shellharbour and 2 in the Shoalhaven local government area. In the Hunter, numbers were lower overnight, 13 cases, 8 in the Port Stephens local government area, 4 in the Lake Macquarie local government area, and 1 in Singleton. Southern New South Wales had, again, 3 cases. 2 of those cases we mentioned yesterday, but they were 2 cases in Merimbula and 1 case in Bateman's Bay. They were both linked to the known case. 26 cases, unfortunately, in the Central Coast. Those numbers remain stubborn. Can I call out to the people and the citizens of the Central Coast to come out and get tested? Please be vigilant and continue to get vaccinated. Outside of that, the Bega Valley, as I touched on, their vaccination rate, 76% first dose and 47.5% second dose, well above the state average, shows that in regional rural New South Wales, the appetite for vaccination is up there. But again, the message to everybody, if you want to continue to see these freedoms, well then get vaccinated.
Thank you, Premier. Good morning, everybody. 2 weeks ago, I stood here and mentioned that New South Wales Ambulance had transported 2,500 COVID patients in the preceding 2 months. Today, I stand here saying that as of midnight last night, there were 5,900 COVID or suspected COVID patients have been transported by New South Wales Ambulance. So in just 2 weeks, this load has doubled on the organisation from the previous 2 months. It's a very challenging time for our paramedics. What I am pleased about is we can clearly see the impacts of increased vaccination as clearly dampening the curve for us and assisting to keep these numbers hopefully down into the future where we get increased rates again to flatten off and reduce the demand on New South Wales Ambulance. Importantly, I would like to begin again by just acknowledging the incredible work that my colleagues are doing out there every single day in support of their community. Our paramedics, as I've said before, they're out there in full PPE, they have to change it every single time, they have to deep clean their ambulances. This is having a very big load on our clinicians, and yet they turn up every single day just to serve their community. Our control centre staff are taking calls at a rate that they've never had to before. More than 1.3 million calls per year come to 000 to ambulance alone. And in this environment, we're taking more than one every 25 seconds somewhere across this state. I'd like to talk to you about three particular initiatives that we're doing at the moment that I think will be important for the community to be reassured about. We're working very closely with New South Wales Health, and in fact I have the Deputy Commissioner working over here full-time at the moment, setting up the New South Wales Health System Control Unit. Now what this is a model where we're taking real-time data from New South Wales Ambulance, we're combining it with data from the emergency departments and the intensive care bed state. Now what this does is it gives us the whole of system view to make sure that as we see some of our hospitals reaching their peak capacity, we're actually able to decompress them and transfer load across the system. Now to the best of our knowledge, this level of integration has never been achieved on this scale anywhere in the world. And I think it bodes really well for the success of the difficult times that we are going to have as a health system going forward. But it's important to know individual hospitals are not just individual hospitals. They are connected to a very broad system. And yes, it is challenging, but everybody is doing everything in their power to make sure we share the load and keep our patients safe to the best of our ability. Another important element of what we're doing is obviously assistance to our regional communities. Across New South Wales, we tend to have smaller hospitals in regional settings. The risk that they could be overwhelmed by comparatively smaller numbers of COVID being very unwell is much higher. So what we're doing is we're surging our retrieval resources, our doctors and nurses of our retrieval system and critical care paramedics. We're putting on additional aircraft. We've secured 2 with our partner airline with RFDS out in Dubbo as we speak. And we'll be doing further in the south and the north of New South Wales. Importantly, we're also adding to the clinical support that our state retrieval consultants are providing to the regions. So we're having additional consultants being there to give advice to other doctors who may be remotely located as to how to treat this very difficult and complex virus that is COVID. The other really important thing that I'm very pleased to announce today is another 60 paramedic interns hit the road as of tomorrow in the greater metropolitan area. This will be a great relief to many of our crews. We've also made a decision in partnership with the Ministry to bring forward all the rest of our recruitment for the rest of this year, which will see another 130 paramedics commence with New South Wales Ambulance on the 27th of September. You can imagine for our staff, this is a very challenging time. We are being impacted by the load on New South Wales Ambulance. Today alone, we will see another expected 3,400 unique 000 calls. This is the sort of thing we see regularly on a New Year's Eve. For the last 2 weeks, we have not had a single day where we have not been at status 2, which is high, across the entire metropolitan area. The impacts of our response performance are being hampered somewhat by the impost of having to do donning and doffing in relation to every single patient. But this is a necessary thing to keep our paramedics safe, and not only them, but also the rest of the community and the patients they're treating. The time it takes to also decontaminate vehicles after they've been treated, patients have been treated, also adds to the lack of availability of ambulances. So not only have we got significant increased call volumes, but we've got a decreased availability across the system. And that's why strategies such as what we've been doing for the last really 6 months of surging additional workforce have been so important to put in place as we now come into the really difficult end of this COVID pandemic. Just in conclusion, I think again it's important to remember the job that our paramedics are doing and what the community can do to help to keep them safe. Many of you here today would have met my paramedic colleague Joe Ibrahim 2 weeks ago, and he spoke very openly and honestly about why he does the job that he does, and that is to serve the community and to take care of his family and his 2 beautiful boys. I'm the proud leader of an organisation of 6,500 people, just like Joe Ibrahim. If you ever want to do anything to help keep a paramedic from harm, go get vaccinated now.
Please don't shout, I can hear everybody. Yep.
Difficult and dire situation.
Yep.
We know that the next few weeks, next month,
we're going to see hospitals come under the greatest stress
Yeah.
they've ever seen. And you and your ministers are about to disappear off camera and cancel this press conference. Are you going into hiding? Why
Not
on
at
earth
all.
that decision?
Can I just say very, very clearly and loudly to the people of New South Wales, we will be here whenever we need to communicate something very importantly to the community.
We're getting a video message.
I will make sure that we are, but what we also need to do is all of us have to start accepting that we need to live with COVID. Because COVID will be around for 3 or 4 years and it's not practical to do everything
Shouldn't
the
you
same.
hold these press conferences until after the peak has passed?
Well, we will never know when that is. But we will never know when the peak exactly has hit. We know what the modelling tells us. I can assure the people of this state, I think they can judge me on my record. Whenever I need to speak directly to the public, I absolutely will. But we also have to make sure that as a government, we normalise the way we do things every day, that we accept that if there isn't anything new to tell the public apart from the daily figures or the daily messages, and health will provide that on a daily basis. But I'm always accountable, always public, as the Minister is. But we also have to accept, all of us have to start thinking about what living with COVID means. And if there's any unexpected occurrence, if there's anything which the public needs to hear directly from government, whether it's myself or the Minister for Health or the Deputy Premier or any of our ministerial colleagues, of course we will do that. But at the very least, we need to make sure that all of us accept what the future holds, but also all of us accept what living with COVID means and what it looks like. And absolutely, that information, New South Wales prides itself on having the most transparent information available, and we can judge very, very accurately when we need to talk directly down the camera to the community. But the community knows we are working 24/7, day and night, as a team to deal with this very difficult situation. And also people, given they've seen the roadmap, are also starting to prepare for what living with COVID looks like. There will be changes moving forward, but those changes are based on good advice, good information flows. And as you see, Dr. Chant also has important work to do and doesn't appear every day. It's really important for us to get the right balance. It's important for us to be able to lead and govern and do what's required. Of course, accountability is something we live with 24/7. But how we communicate and how we present that information is better managed when we present ourselves in a particular way.
Premier, do you understand, though, that people may feel concerned after having heard this week and last week with the Burnett modelling that the worst is still to come and that we're far from over the peak yet? And in fact, I think you said yesterday, we're not out of the woods yet. People seek that reassurance and the opportunity to scrutinise the decisions the government is making. Parliament is not sitting. You won't let Parliament sit. Despite advice from Kerry Chant now saying that she doesn't oppose it, how do people have confidence that scrutiny of government is taking place?
Firstly, I'm looking forward to Parliament resuming on the 12th of October, which is the date we've already given. Secondly, myself and all of my team are accountable every day. You'll still see me a couple of, quite frequently every week talking down the camera. I will be there. I'll be there 24/7 as I have been, and I'll turn up when I need to. But to expect the Leader of the Government indefinitely to do this every day means that I'm not doing my job properly. I need to make sure we have a good balance. We need to make sure we all live with COVID. And of course I'll continue to be accountable. I'm accountable every day. And if there's any important message or any surge or any issue that we need to communicate with, myself or the Minister for Health or anybody else will do that. But we have to accept that life with COVID means accepting that we have to live with COVID. It means adjusting. All of us have to adjust. And I think on the one hand, the community wants the information, is craving the information. They want to hear from me. They want to hear from others. But when we've got something to say, apart from repeating the numbers that health repeats, we need to make sure we have something important to say. And I think people understand the messaging. I think people understand what needs to happen to keep everybody safe. And if there's any time that myself or the Health Minister or Dr. Chan, if there's any time we need to speak directly to the public, of course we will. It might be 3 times a week instead of 7 times a week. But the message is that we will speak every time there's something important to say, and I'm accountable 24/7 every day of the week, and that stays the case.
Aren't you risking a breakdown in communication at such a crucial time when we haven't hit peak caseloads or peak hospitalisations yet?
Well, none of us will know exactly when that number is, but rest assured that we will, of course, continue to communicate directly. We will, of course, make sure the public has that information. But the public also wants to know, apart from the information, if there's something new we need to say, of course we will. But the public understands what we've been saying every day, and Health will continue that message at 11 o'clock every day. Stay at home unless you have to leave the house. Make sure you follow the health orders and get vaccinated. Now, that's been consistent. And if there's any situation where we need to explain anything that's going on or anything that's different, of course we will, and the public appreciates that. The public knows we are working on the case 24/7, but we also have to make sure that we present information when the public needs it and when it's important to do so, and that remains the case. You'll still see me frequently. I had some of you complaining that every day was too frequent. But the point is, the community will be given every information on a daily basis. We have the most transparent information of any state. I don't know if any other state government goes through the daily information we do, as well as the vaccination rates, as well as, regrettably, the people have lost their lives and their circumstances. And we'll continue to do that on a daily basis. And you'll continue to see me frequently.
If we accept that you can't hold a press conference every day indefinitely, why not hand it over to a health official or someone else that can still engage with the community in a press conference?
But that's exactly what I said. The health official will provide an information every single day. And if there's questions, anyway, with all due respect, we'll obviously make sure that information is given. All the responses to questions, all the issues that are raised will be responded to. But we also have to expect that living with COVID is something all of us have to come to terms with, and all of us have to make sure we, number one, are accountable, but also that we support our community during this time.
Premier, just in terms of the vaccination rate, can we just do that?
Publishing case numbers every day?
Oh no, we will continue to publish case numbers every day until at least 70% double dose or more.
70% double dose could be next month.
Well, we will continue to publish case numbers every day indefinitely. But what we speak about into the future, and this is the basis of the Doherty report, publicly available information will occur on a daily basis indefinitely. Can I make that point clear? But what is most important for us, the figures that the public really needs to keep an eye on, are our vaccination rates and how many people are in hospital, whether it's intensive care or broader hospitalisation. They're the two most important figures. Of course, we'll continue to provide all those figures available. That's important information. But as time goes on, people will realise the most important figure is what proportion of our population are vaccinated, and then also what proportion of our population are unfortunately having to meet with our ambulance or our hospital system. And they're the two figures that are most critical moving forward.
Just in terms of the vaccine.
Yesterday that 70% roadmap freedoms were contingent on us getting the cases down, and that cases are lower, but we haven't got any kind of specific number on that. Clearly the numbers are important. So what is the number? What is the number that we have to get these cases to for us to hit 70%?
Look, can I make very clear that at 70% double dose vaccination, everybody will be able to enjoy those things that are in the roadmap.
No matter
the condition is, though, if a particular town anywhere in the state or a suburb or maybe a local government area has a surge or very high case numbers, Health will provide advice to say, in that area, you'll still be able to do everything on that roadmap, but you'll have to do it within your local government area or within 5 kilometres of your local government area. So that is the condition, and we've made that very clear, and the Doherty plan makes that very clear. So everybody who is double vaccinated at 70% will be able to go to a cafe to have a meal, will be able to do all those things in the plan, to get their hair done at the hairdresser. All those things in the plan stand for anybody who is vaccinated when we hit 70% double dose. But Whether or not they'll be able to move freely across every single part of the state depends on what cases are doing in a particular location, and this is in the national plan. Until you hit 80% double dose, you have to be proceeding with caution, and we're very hopeful that by the time we get to that time in October when we have 70% of the population double vaccinated, that at that time we will see many areas of concern that are areas of concern today, not local government areas of concern by that time. That is our hope, and that is in our hands. If we continue to get vaccinated, we continue to follow the health orders, we have seen stabilisation and decreasing numbers in a number of areas, and that is positive. But we know the worst of the worst in terms of the numbers, in terms of the cases, we're likely to experience sometime next week. But the health experts will give me good advice as to when they feel things are turning in terms of declining numbers. But we have to be very clear that the Doherty plan, the national plan we've all signed up to, says that 70% double dose, every adult who is fully vaccinated will be able to enjoy those things. The one condition is, and that is condition of if there is a particular surge in a particular area or case numbers remain extremely high, we have to limit mobility. You can still do those things, but within a designated area, because by that stage we certainly don't want seeding of the virus in parts of the community or parts of the state that don't have virus.
Travel that's going to occur around the state from this weekend with those areas coming out of lockdown, just coming off the back of what the Commissioner said, are you concerned that people are going to hit the road, go through small communities for fuel or stop at a bakery and lead to Wilcannia 2.0?
Well, obviously there is, for every decision you take, there is a risk. Every decision you take is a balanced risk of what are the benefits and what are the risks. And the risks which health presented to us was that obviously if there's parts of New South Wales which are designated communities which haven't had virus for at least 2 weeks, things can change. But as in people can go back to restrictions as opposed to having to stay at home. But this is a moving feast, and I think the public appreciates that if too many people do the wrong thing at any one time, whether it's in the regions or whether it's in Greater Metropolitan Sydney, that things might need to get adjusted. And the national plan says that until you hit 80% double dose, you run the risk of maintaining stricter rules in terms of mobility until you have the confidence that there's sufficient coverage of vaccine in the adult population.
The amount of young people that are fully vaccinated, I mean, it's only projected to be about 50% by the time we get to mid-October. They make up the bulk of infections now, the bulk of that hospo retail workforce. So if not enough of them are fully vaccinated by the time we get there, will you still press ahead with reopening? And what if businesses aren't in a position to reopen because not enough of their staff are fully vaccinated? Well,
obviously, that's why we put the roadmap out yesterday, to give everybody a lot of time. So you'll notice in the local government areas...
But availability is like a big problem with vaccines, and it's still, the first doses is still...
Yeah, if you let me finish the question. Yeah. So in the local government areas of concern, as you know, we've pushed for weeks and weeks for everybody between the ages of 16 and 39 to come forward and get vaccinated. So for the hundreds of thousands of people in that category, I think we've done literally 700,000 or 800,000 people between those ages. If you look at 16 to 39-year-olds in especially those local government areas of concern, we've been pushing people to come forward and get vaccinated. So there isn't a single young person in a huge chunk of Greater Sydney who hasn't been offered the vaccine. We appreciate that in some other parts of Sydney, some people may be concerned with access, but we've said come forward and get vaccinated. There are a couple of very good vaccines available. And if you have any issues, speak to your GP. But there is vaccine available, and that's why we're giving people time. And we also expect that towards the end of September and October, early October, that we will get more supply of vaccine, which we're looking forward to. And obviously we appreciate that some people might not have their booking till a bit later on, and you know, we'd love to see more supply, and I understand that's coming towards the end of September and early October.
Premier, just on HSC exams, what is the justification behind pushing ahead with these exams, putting that stress on young people? Are you worried about their mental health going into the biggest exams of their lifetime when they've barely been in the classroom?
Well, the Education Minister, Minister Mitchell, will be providing further details about that today. But can I stress the most important thing for all of our Year 12 students to know is that they will qualify for the HSC. Many have worked a long time. to achieve those results, and the New South Wales Education Department has been working with health as to what is the best way to do that, and of course mental health has been top of mind. It's also important to note that many experts have been advising government that students need something to work towards, to feel motivated and to feel that they've achieved their HSC. And so all those things have been taken into account, as well as getting advice from independent bodies, the Standards Authority body and others in New South Wales. So Minister Mitchell will be providing further detail this afternoon on those matters, but please know that all of those things have been considered. We know it's been a tough time for Year 12 students, but we're also trying to make sure we have the best way forward for them, and so that they can qualify and so that they can obviously get on with life in a positive way next year, whether it's working, whether it's getting a trade, or whether it's going to university. All those options will be available to them, and I want to thank both our Education Department, Health, but also the university sector, who's been very understanding and patient to accept that the results coming through will be a bit later than usual, but that means that no child, no student will be disadvantaged.
Premier, in regards to the back-to-school timetable, if we hit the 70% mark earlier than you anticipate, say early October, is there a chance of those dates being changed?
No, that's why we were very clear. It's very, very difficult to create uncertainty when schools are going back. You need to provide a fixed date. We have thousands and thousands of staff and school communities across the state who rely on certainty, a plan to go back, planning lessons. Unlike adult activity, where you can be a bit more flexible with dates and when things might happen, we were very keen to make sure we provided a fixed date for when school would go back, so that all of our school communities, all of our teachers had certainty. As you can appreciate, planning for classes, planning for learning, planning for safe practices within schools. I mean, every school will need to do things differently as a result of COVID. So for all those reasons, all those planning reasons and requirements, we wanted to make sure schools had a fixed date. So it doesn't matter when we get to the 70% double dose. The 25th of October is the date that schools will start coming back. And that was a very, very considered decision, but also a deliberate one. That irrespective of when we hit 70% double dose, that students would come back on that day. We assumed it would be some date in October, and it's likely to be the middle of October, but I also want to make the point that vaccination rates have slowed down a bit in the last week. So we were getting about 1.5% new people come forward every day of the state, which is a great number, but it's gone back to about 1%. So I just want to say to everybody, let's get over the hump of the rate slowing down. Let's make sure we speed up the rate at which everybody gets vaccinated. And we would like to see the first dose rate around 85% by the time we open the 70% double dose. Sometime next week we'll hit 80% first dose, which is fantastic. That means we'll hit our second target of 80% double dose. But you know, the higher that figure is for first dose will give us greater confidence as we consider what the roadmap at 80% looks like as well.
Premier, just on that rate dropping.
I'm sorry?
Just on the vaccination rate dropping, do we know why? Is it because there are fewer people coming forward for first doses? Can we prioritise bringing forward second doses for those who have gone 6 to 8 weeks? And also, are there appointments available? Do we know that there are appointments available that people can book in now?
So the issue is a couple of issues. One of the issues is supply. So there's obviously supply is a little bit lumpy in September. We're grateful for the extra doses we've been given, but there's a little bit of a lumpiness in supply, especially for younger people. So that's one challenge. The other challenge is because we had such a big push for first dose, obviously people have to wait a few weeks for their second dose. So there's those issues as well. But there is ample supply at Kudos Bank Arena today if people want to go and get the AstraZeneca. So there's ample supply of vaccine. I've had the AstraZeneca and I encourage people to get vaccinated. We still see people over 70 years of age or over 50 years of age who aren't vaccinated. There's no reason why anybody shouldn't come forward and get vaccinated. So we just want to make sure that people come forward as quickly as possible. We've seen in other places around the world things start slowing down between 70 and 80%. We don't want to see that here. We want to make sure that we get as many people covered as possible. And, I hold the ambition Dr. Chant holds. I'd love to see our first doses get close to 90%. That's our dream, because then we know we're all safer, we're all more covered, and it means we can protect our health staff. I think every day about our health staff, because the more people that need to be hospitalised, the more people that are that are presenting obviously is a risk to our staff and our system. And the higher we get of that first dose, the quicker we get to 85 or 90% would bring us great joy, and I feel confident we can get there. Who hasn't asked a question? Yeah, sorry. Yeah.
Just on booster doses, there's evidence that after 6 months there's a lag in protection from Pfizer, not the AstraZeneca, that is a longer lasting protection, but with the Pfizer, a lot of our healthcare workers would have got Pfizer about in February or March, first up. Are we planning to start rolling out booster shots now at that 6 month mark?
Yeah, I certainly raised this issue at National Cabinet, and I was provided information that Australia, the federal government, has secured boosters in a sufficient supply. And obviously, once we get over vaccinating our population the first time round, we'll have something to say about that. But it is an issue that I raised at National Cabinet on a number of occasions, and the federal government is confident that we have sufficient supply. But there are still lots of people in New South Wales that haven't even had one dose of anything. So we really need to focus on that. We really need to focus on people coming forward for the first time and getting vaccinated. It's really important that if you haven't had the vaccine yet, please come forward and do so. It's really important for the greater good, for reducing the spread, and also to keeping your loved ones safe.
We're still getting a lot of calls from people who have got their vaccines but cannot get their vaccine passport. It's not uploading. There's some kind of bureaucratic issue in the system. What do? Monday they can go to picnics, but they can't prove it.
Yeah, well, obviously the process for acquiring your vaccination passport through the Medicare app, I'm told is reliable and has been providing people that information. I don't know otherwise, but suffice to say, as I've said, in addition to the federal government information you can get to prove your vaccination, New South Wales will be using the data that the federal government will be making available to us to develop our own passport, so that when you use your New South Wales or your Service New South Wales app to check in anywhere, you automatically will get your vaccine credentials there, so you won't have to do anything extra. We're hoping that'll come into effect, obviously in early to mid before we open up at 70% double dose, definitely in early October. But in the meantime, you can download that information as much as I understand, and we'll follow up on that.
Regards to the lockdown ending in different regions, you mentioned this morning there were two regions in particular, Lithgow and Mid-Coast, that you were reviewing this morning. Have you actually come to a conclusion there?
Well, Lithgow, unfortunately, had a case on Saturday. I was on 2GB and it was wrongly reported they had no case. So they had a case Saturday, and overnight another case announced today in Lithgow. So Lithgow remains in lockdown. Mid-Coast local government area, we're still reviewing. We're going through that, and Dr. Kerry Chan will give me a response this afternoon.
Just about sport, you know how important this is for communities. Yeah. You've effectively killed it off for the rest of the season. Can you explain to communities why they can get a haircut, sit in a cafe, train for sport, but not play the game?
Well, look, the reality here is that when we set out the roadmap and when we set out the conditions for reopening regional rural New South Wales, it's based on risk. And one of the things we wanted to do was make sure we supported businesses. We know businesses were hurting, they were hemorrhaging, and businesses were falling over. So we needed to reboot the economy, reboot those jobs, support those communities, give a level of mobility. But we never said that we could come back pre-lockdown, because the risk of infection remains. And this is, I've used it before, it's a tinderbox that could explode at any time. Why community sport? Community sport often is run by volunteers. You have no ability to control what's happening on the sidelines, spectators. We don't have the QR code system complete on all our ovals. It's volunteers running canteens. So when you measure against risk, it's better that you actually stay on the side of caution, and that's why we made that decision. It's the same at the 70% roadmap. Again, we've decided that community sport brings a level of risk, and we've got to manage that level of risk while we reboot everything else. We never said at 70% we could do everything. What we've said, we're going to try and give everyone a taste of freedom, and that at 80%, some of these other things that have been left out will come back, and that's the patience that I'm asking people to please give us.
Clarity to on the architect of the roadmap and the plan. In terms of businesses and what happens now in a COVID positive case comes into a pub, a venue, a hairdresser. In the old days, of course, we closed the place down 14 days and everybody would have been considered close contact. But now, post 70% double vaxxers, does business just go on?
So Dr. Kerry Chan said it yesterday, and and the Premier touched on it this morning. If there is a case that happens after 70% double dose in a venue we'll have a different approach to probably in the past because you are dealing with vaccinated people. We have more to say around quarantining, more to say about isolation, and we'll say that in the weeks ahead, well before we get to the 70% opening date. So there is more to be done in that space. So again, for businesses, the best thing you can do now is prepare to open, get your staff vaccinated, put in place your COVID safe plans. This will be all available. The QR coding that Victor Dominello is preparing, where you check in, is also your vaccination passport. Businesses can register. All this will happen. But what we're going through and what the Doherty report talks about is if there are cases, if there are issues, then there are suppression measures that, of course, New South Wales Health has the ability to put in place. And we'll work with businesses. We want to move away from the days that we lock down the state as a whole, and that is what the plan is all about.
So many people are so keen to take a holiday on the road trip risk, but towns are terrified that they're about to have people through. Should the messaging be think about where you stop and make it not a community of 200 people?
Well, firstly, nothing's changed that people can leave Sydney for outside of the stay-home order. So there's nothing's changed that should bring any greater risk to regional rural New South Wales that was there before. The reason we lifted the restrictions is still in a very restricted environment, is to put a layer of protection for those regions. And those in regional rural New South Wales, if you are travelling around, only do so if you have to. If you travel into a local government area that is in current lockdown, those stay-home orders apply to you. So there's no point going to an area of local government where there is a lockdown. And for those that are in lockdown areas, you still have the stay-home orders apply to you. So there's so many levels of protection to minimise mobility and movement, especially from areas and local government areas where there are cases. And for the rest of the regions where you've been opened up, again, be vigilant. This is not about opening and closing. This is about being vigilant, get vaccinated, and limit mobility if you want to remain open.
There are reports that Dr. Chant said that she would only be comfortable with the roadmap kicking in from 80 to 85%. Is that true?
Well, can I say, I prepared the roadmap. I brought the roadmap to the crisis committee. I had the endorsement of Health, including Dr. Kerry Chant. I'll put it this way. Health, if they could, they would love to see more vaccinations, keep the place locked down, but we've got to find a balance. We've got to keep people on the journey. And with the Doherty Institute work, with the roadmap, the federal roadmap, and the agreement of the Chief Ministers and the Premiers, we were able to develop a roadmap that is endorsed and supported by New South Wales Health, and that is the roadmap we have released.
Can I just follow up on contact tracing? Sorry, Deputy Premier.
Sorry.
Oh, maybe Dr. Sorry, can we just follow up on the contact tracing from a couple of questions ago? Because it's an incentive. If you're fully vaccinated and you become a close contact, is it possible that you would only have to isolate for a couple of days? Because that's another added incentive to get vaccinated.
Look, that's right. And as the Premier mentioned earlier and the Deputy Premier, these are all issues that we're actively looking into, noting that as we go forward, the way that we've approached contact tracing in the past isn't necessarily going to look the same going forward as we see an increasingly large proportion of the population vaccinated. We've already made changes to the processes along the way, as we've shared with you, and different approaches to the risk assessment that we're making, and that's a work in progress, and that's the thinking that we're developing, and so they're all issues that we're going to be sharing in due course. But as the Premier has said, things will look different, including how we approach isolation, how we look at casual contacts, how we look at close contacts, and so they're all issues that we're working through, and we'll be sharing in due course.
There are reports that whole families who've tested positive are now being treated together in hospital. Could you talk a little bit about that?
Yeah, so since the beginning of the Delta outbreak, one of the key features has been the significant transmission in households that we have seen, and often up to 70% of the cases that we've seen have been people in the household. And that's just an indication of how transmissible this Delta variant is. It is a different picture to what we saw last year with previous variants. So yes, we have seen households, and often once there's a case in the household, very high likelihood that everybody else in that household does become positive. And sometimes multiple people in a household will require hospitalisation. And as we've heard from our ICU colleagues standing here in the past, often some very difficult situations where parents might be severely unwell in hospital. As we've heard from our paediatric colleagues, sometimes children being admitted to hospital for social reasons because parents are too sick to take care of them. So we are seeing that phenomenon, and again, really important as to why getting vaccinated is so important to protect not only yourself but your family and your loved ones, to protect the people in your household. And one of the best things that we can do to protect children as well at this present time, and young children, is for the adults around them to get vaccinated. So again, I encourage everyone in the community, if you haven't had a dose, if you haven't had your second dose, please book in.
25% of people over 16 haven't had a dose of vaccination. And Dr. Chan has been talking a lot about vaccine equity and making sure we get high rates in really vulnerable groups. Are there people within that 25% that are disproportionately represented, particularly vulnerable groups, that worry you?
Look, absolutely, and one of the key issues as we go forward is achieving high vaccination coverage across all segments of our population. So we want to see that high rate of vaccination across the population as a whole, but equally important that we get high rates of vaccination amongst different demographic segments of our population, and that might be people from different ethnic and language groups, Aboriginal people, people who have mental health issues or substance use issues or live in social housing. We want to make sure across the breadth of our diverse communities that the vaccine coverage is as high as it can possibly be. And that's going to be essential as we go forward to interrupt trains of transmission and make sure that across the board we have the best protection against transmission of Delta as we can. So not only that overall population coverage, but good coverage across all different segments of our diverse community.
Just a question on the effective reproductive rate. Are you still comfortable with opening at 7% if it's above 1?
Dr. Chan addressed this issue yesterday. So obviously, when case numbers decline, according to our modelling, once you turn the corner and case numbers decline, that means you have an R effective below 1. So we're anticipating that will occur before we hit 70%. Yesterday we gave all the conditions under which the roadmap would be conditional, and that is if we see a high number of cases in particular areas, those people who are fully vaccinated will enjoy what's in the roadmap but confined to a smaller geographic region, and we made that point clear yesterday.
Commissioner, can I ask just quickly to the Commissioner if we can, how frustrating is it for you to watch your colleagues, your members, lining up for sometimes hours outside of hospitals as that bottleneck happens in emergency departments trying to get COVID patients into hospitals? And secondly, is there a chance we're going to see people dying as they wait in ambulances, or indeed they can't get into ambulances because there's so many of them trapped at hospitals in queues?
The critical thing that I would say to that is I know that every doctor, every nurse and every paramedic in this state is doing the best they can to look after their patients. So the fact is, it's a reality that they have to be super cautious when dealing with patients who potentially will contaminate them and other patients in the hospital. And it does take a long time. We do know that some weeks ago there were some significant delays that were being experienced right across the board, and that was largely due to the need to adapt and change models of care. We've seen a lot of improvement in that area, but there is absolutely no doubt there are still long, extensive delays. And look through the eyes of a paramedic for 5 minutes, sitting there in full PPE, you literally are drenched to the skin, waiting to process the patient through into hospital. It's very frustrating, but they are doing it for the right reasons and for the safety of the patients and the paramedics.
On that ramping issue though, on that ramping issue though, it is, I understand that there are still a number of ambulances where the calls are lights and sirens that are having to wait, a number of calls going out, and there's not enough staff right now. Are you concerned that we are at a critical point right now, and do you have enough right now to cover the situation that is going on?
So critically important. We've actually been ramping up the staffing right through since April of this year. We've literally done back-to-back internships and tomorrow another 60 interns start on the road with New South Wales Ambulance. So to put this into perspective for you, I know we're 20 crews additional tomorrow than what we would normally put out across the metropolitan area. That's a combination of the surging of the interns, and it's also the fact that we offered voluntary recall for leave. And I think this is testament to the calibre of people that work at New South Wales Ambulance. I made that decision last Saturday afternoon, and by Monday morning 50 paramedics had returned from leave voluntarily to man the front line. It's fantastic to see.
Mr. Hazzard, a question. In terms of how long will people that haven't received the vaccine kind of be shut out of society effectively? Like, do you anticipate like 6 months?
I'm sorry, what's the question again?
How long do you anticipate people that aren't vaccinated to be kind of cut off from the rest of New South Wales in the sense of the freedom?
Well, first of all, that's your assumption, your coloured summary, which is not necessarily right. Can I just say the issue is quite simple. If you want to keep yourself safe, if you want to keep your family safe, if you want to keep the community safe, we all have it in our hands to go and get vaccinated. We've laid out very clearly that's what's necessary and that's what we all should do. And can I say that the 70% target of double vaccination is this first major step to back to our normal lives, and it's freedom. And I would just say, everybody go and get vaccinated. Thank you. Last question? But there's an extra question.
Allow only double vaccinated
Never is
people.
last questions, here they really. Yeah, go on.
Can regional businesses allow only double vaccinated people from tomorrow if they're opening up? Given there's no health order yet, do they have a right to refuse and bring that rule in themselves as a business now?
Well, any business at any stage, by virtue of their own contractual obligations, or when you walk into a door of a business, in effect, you're there on the basis of the terms that you come in. I mean,
and that's where we farewell viewers on the main ABC channel in WA. If you want to continue watching this, you can do so on the ABC News channel.
Tomorrow wants to keep safe, and they say be double vaccinated. Back to business all the way, because that's what should happen. We need to go and get double vaccinated, and that is the last question. Thank you all. See you tomorrow. See you tomorrow.